There's definitely continued transmission in Belize of COVID-19. The numbers continue to go up as is expected, with especially a variant like Omicron, which we know is extremely more transmissible than the original variant. And of course, we don't have a lot of public health measures in place at this point. And people basically are not feeling as unwell as they did with Delta and with the original variant. All these things are factors that impact what we do, how we move about, whether we ensure that we utilize our mask, whether we ensure that we are vaccinated. All these things play a part in that. And I believe that that's the main issue at this point. When you look at Omicron, though, we also need to monitor hospitalizations. And we know that our hospitalizations are quite low. And we also know that the case fatality rate has been reduced significantly, which means that the number of people dying directly as a result of COVID compared to the number who have COVID is very low. Having said that, it's very important that any infectious disease is controlled. Because we don't only look at mortality rate, we look at how it affects our economy, how it affects you personally. We don't know as yet the long-term effects of COVID, even if you're asymptomatic or mildly symptomatic. Research is still ongoing with that. So the Ministry of Health and Wellness, we strongly recommend that you continue with your measures, you continue to protect your vulnerable population, ensure that especially the elderly, people with comorbidities, continue to be protected. If you are sick, whether you think that it's because of some other reason, still take precaution, because we don't want any sort of, even if it's, upper respiratory tract infection, a flu, we don't want that to be spreading either. So it's important to still keep in mind what we need to do to reduce the spread.